Good morning, everyone. Welcome back to my channel. I'm Richelle, the Real Life Carnivore. Today is going to be a super awesome day. I have two very amazing and very interesting people that I'm excited to introduce to you today. You guys are going to be able to ask questions if you have questions. And I'm really excited for them to share their stories and their testimonies for you guys to further learn about the many benefits of this way of eating and also how much your life can change just in the blink of an eye. So I'm going to bring them on. Please join me in welcoming Shawn and Janet Needham. Good morning. Good morning. Welcome. Welcome. How are you guys?
Doing great. Thank you for having us on.
Yeah, thank you for being here. Well, I would love to start by you guys sharing your story. Can you tell us a little bit about who you are?
Janet, go.
Okay, well, I am from North Dakota State, and I moved out to Washington after graduating from pharmacy school, where shortly after I moved out, I met my husband, and he was continuing his last year of school, and we landed in a profession where sick care was the model. And for years, we struggled with that. Even though we were excited about a profession, we just found that so many of our own clients were not achieving health. They were really actually declining as time went on. And that was something that tore at us a lot, weighed very heavily. So we decided to journey together to actually open our own pharmacy. That helped to some degree, but it wasn't until I had a client by the name of Patty who called me up one day. She was morbidly obese. She was 50 years old and she was on her deathbed. And Patty said to me, "Thanks, Janet, for Shawn and you for doing everything that you've done for me. I just want to let you know I love you and I'm thankful." And at that moment, something clicked inside of me where I was like, I don't think I helped Patty. I think I helped dig her grave. And really, in a moral way, I had to look in the mirror and say, am I helping my clients achieve health? Are we getting there with what we are doing? And it was kind of a pivotal moment for Shawn and I in our career as to what direction we were going to take our business and how we were going to help people.
And so basically we decided to commit to, instead of committing to more medications and more pharmaceuticals for all these diseases, we decided to commit to pro-health. And so that's basically what we talk about now. We help people get off medications. I mean, so many medications are prescribed for conditions that are diet and lifestyle related. Just to name a few, gastrointestinal reflux, irritable bowel syndrome, type 2 diabetes, hypertension, all diseases that we give drugs for, where really what we need to do is change people's lifestyle and diets.
I think this is a really important subject to discuss because you guys were both living in that pharmaceutical world, in the, like you said, the world of sick people, and you realize like diet is the key here. How important is diet actually, do you think? Like what percentage, if you had to give it a percentage, what percentage of lifestyle wellness or overall health and wellness would you say is related to your diet?
85%.
85%. That's
Absolutely.
pretty significant.
It is. And, even to that, you're familiar with Shawn Baker. And Shawn Baker, we've interviewed him on our podcast a few times. And I asked him the same question you just asked me. And as a pharmacist, it's pretty, if you're honest with yourself, it's pretty easy to answer because you see all these drugs are being prescribed for things that are obviously lifestyle related. But I wanted to ask him as an orthopedic surgeon, what percentage of patients that you see as an orthopedic surgeon would not need surgery if they change their diet? And as a pharmacist, I understand the physiology of the drugs and the pharmacology of that and how they work. So I understood how most of those were diet and lifestyle related drugs that were being prescribed. But as a pharmacist, I don't understand orthopedic surgery. I don't understand anatomy as much. And so I thought his answer was going to be 25, 30%. But Shawn Baker, orthopedic surgeon, said that 70% of all people's surgeries for orthopedic surgery would not be needed if they changed their diet. I was astonished.
70% is like mind blowing to me. That is so significant.
It is.
So significant.
Right, Richelle, we're talking knee surgeries, hip surgeries, shoulder surgeries. 70% are unnecessary. I'm going to guess, if you think about it rationally, probably the ones that are necessary are the ones that are trauma related. You know, like when my son broke his leg jumping a canal, he had a compound fracture of the tibia. That's a surgery he needed. But you know, when somebody's 150 pounds overweight, they don't need a new knee. They need to lose weight.
Oh my gosh. Okay, so when you had this epiphany, especially you, Miss Janet, when you had the epiphany about how you felt like morally you helped this person dig their grave, what did you guys start to do? Did you guys start researching? What were your next steps?
Well, you know, unfortunately, it's slow going sometimes. We kind of had to relearn and rethink because, you know, both Shawn and I worked really hard to get our degree. We both paid for it out of our own pocket, very low, you know, student loan debt. So we worked hard as we went to school. So for us to decide that what we were learning wasn't working, it was a hard pill to swallow. We did. We had to research. We had to take some continuing education, start reading, start applying things that we already knew. But, you know, we also had to live it a little bit. Shawn can maybe talk about that too. But in our own household, we had to change our own mindset as well.
Yeah, that's for sure. About 10 years ago, actually, wow,
It's been longer
time
than
goes fast. 15 years ago, I, you know, was morbidly obese, and I lost a bunch of weight by, you know, changing my diet mostly. And, you know, my kids were approaching teenage years, and I wanted to be able to, you know, be active with them. So I decided to change my diet. At the same time, we were kind of moving towards a more health and wellness type pharmacy. And, you know, it doesn't look very good if here I am, I'm 60 pounds overweight, and I'm trying to promote health and wellness to patients, or tell them things that they should do, but yet I'm not doing them. So I think that's one of the important things as a healthcare professional. We need to be good role models. And one of the things I tell people is, you know, why would you trust a fat doctor? I mean, if you went to a dentist and a dentist had yellow crooked teeth, you'd walk out. You wouldn't let him touch your teeth. But yet in healthcare in general, many doctors, most nurses, most pharmacists, they're metabolically unhealthy. And I like to say that they're drinking the Kool-Aid in the healthcare system. You know, it's contagious. Their health is contagious to each other. They hang around a bunch of sick people at work, and they just think that this is normal. And it's just normal to be on 10 different medications. And we want to make it so it's not normal, because it's not normal. We've made that normal over the last 30 years, but it doesn't have to be normal.
Yeah, I'm with you 100% on that. And I find it so interesting. Anytime I've ever been to a hospital or a clinic, it's very rare that the people who are treating you are in better health than 90% of the population. And I think the current state of our population here in America is very devastating. What is it? 60 to 70% of Americans are metabolically sick right now. Is that the rate?
That's the rate we're hearing. And, you know, so that leads to, you know, what we were kind of questioning in our minds. If we've been doing the same thing from the time Shawn and I graduated, which, you know, not to put too much of a timeline, but decades, we've been doing the same thing over and over again and just adding the same thing on top of it. It's kind of the definition of insanity, right? Like, if we keep throwing meds at weight, how are we solving our health problems? It comes down to, like we've been talking, our lifestyle. It's our day-to-day in and out activity, how we sleep, how we work out, how we choose to put food in our bodies. So that has a bigger impact in my mind long term than spending all these dollars that we've been doing in the last 3 decades on big pharma.
Oh, yeah. Which actually leads me to something that I find is very touchy for a lot of people to discuss. What are your thoughts about like GLP-1s, Ozempic? Do you guys think that those are good tools? Do you think they're helpful in the right situations? What are your thoughts on that?
We actually just did almost an hour podcast on somebody else's podcast on this subject. I shared it on my Facebook page a few days ago. It released on the 9th, I think. And, obesity is the most dangerous thing that you can do as an American. Being overweight as an American is the most dangerous thing that you can do. Those are the facts, because obesity-related disease kill more Americans than anything. Cardiovascular disease, diabetes, all those, they kill more Americans than anything. So anything you can do to lose weight in general is probably good. Now, there's some things we don't recommend. We would never recommend bariatric surgery. I'm speaking for Janet, but we don't recommend bariatric surgery because it's such a huge intervention, and the long-term complications are not reversible. When you have nutritional absorption deficiencies and things like that, and many people, now that we're a few decades past, when the bariatric surgery started, we're seeing the ramifications that a lot of people regain the weight. So you go through an intense process with long-term complications, and you don't change your lifestyle. So they learn to eat around that. Well, Ozempic is probably safer than bariatric surgery, but what are you going to do? Are you going to be on Ozempic the rest of your life? Seriously, you long term, you have to change your diet. So, if you're going to do it to lose 20, 30 pounds to get kickstarted, then, in a few months, then fine. But when you look at the long-term studies of it now, since it's been on the market a few years now, when you look at it, over on average, they lose 15 to 20% of their weight. And that was 38 pounds over 64 weeks. So think about that, Richelle. That's over a year, you lose 38 pounds. That's not a lot of weight necessarily. And when they started out, if it's only 15% of their weight, then that means that they started out around 290 pounds. So from 290 to 38 pounds is not that much, really, relatively speaking. But here's the problem. That 38 pounds, 24 pounds was fat, 14 pounds was muscle. That's a big problem. So that's what we're seeing with Ozempic, is that they're losing muscle mass. Well, all the benefits of muscle mass, how it helps us to burn calories, so many benefits of having good lean body mass. And especially with women, it's very, very important for our long-term health.
Mm-hmm. Okay, I just did the math, and you said 38 pounds was the average over 64 weeks. That's 0.59 pounds per week.
Exactly.
That you're losing.
Right. And as a bodybuilder, as a former bodybuilder, that's not that much.
No, no, it's not.
You should be able to, at first, depending on what your weight starts at, you should be able to pretty easily lose, on average, 2 pounds a week. And long term, a pound to a pound and a half is not that unrealistic.
So herein lies the other issue. If you are losing your muscle mass in this way, and you start calculating that, and then you don't add the proper exercise and the proper protein replacement, right? What's happening to your connective tissue? What's happening to your heart muscle? What's happening to your bones? And this is actually going to the point where we're looking at putting 6-year-olds and up on this medication, which to me is mind-boggling, because this is where their bodies are being and creating. And even if we're talking about 20s to your 30s, it's a huge building time for your body and your tissue. So what are we setting people up for? Short term, we're saying, okay, but long term, I'm like, no way. And then the way it works is it slows the motility of your gut. So the side effects of not having your gut work to me, that could be long-term and really, really a bad scenario for some people.
I feel like it's this, and this is why it is so touchy, this subject, because for some people, they think that it's the only solution. And I think it's because they're running around like this and they don't want to change. They want to buy into the fact that, hey, I can just take this magic pill or this magic injection. I can still do all of the same things and I can lose weight. And it's like, yeah, that's true. But like we were just talking about, it's coming at the cost of your muscle. It's probably coming at the cost of your bone density. I just think that those commodities are more valuable than anything. And it just doesn't make sense to me how unfortunate it is that people are just so unwilling to change or so unwilling to even acknowledge, that what they're eating could be contributing to the size that they are, or to the inflammation that they have, or to the pain or the digestive issues or the mental health conditions. Like there are just, to me, it just really irks me that people are just wanting to just be so prideful and proud about it. Like, and I bring that up because you guys had to humble yourselves about your training and your schooling. And you're like, wow, everything we have been learning is, not necessarily the best application moving forward. And I think that takes a lot of humility. And I think that that's what people are really lacking in these days is humility. Like I remember coming to the carnivore diet and I was like, oh, it just feels like one more really restrictive diet. I didn't realize that it's not a diet. It's a way of living. It's a way of detoxing my body. It's a way of reducing inflammation. It's a way of getting my life back, getting my body pain free, getting my fertility back, getting my strength back, getting my cognition back, getting my mood back. Like there was so much more to it than that. But I think people are just so hesitant because, like me, it just sounded so restrictive. So when people think or come to you and say, well, that just sounds really restrictive to, make these minute changes in my diet or to do something drastic like go keto or carnivore, what do you say to those people? How do you navigate that conversation with them?
Well, I mean, restrictive, first of all, you either change your diet and your lifestyle now, or you end up walking with a walker or being in a wheelchair, or being bedbound when you're older. So that's one of the things I would say and that's restrictive. If you're sitting in a hospital bed or in a nursing home, that's what I would call restrictive. So another thing, just to go back on the Ozempic, is, one of the simplest things that, and not just on Ozempic, but on a lot of drugs, on most drugs, we just ask people, look, do you have an Ozempic deficiency? Do obese people have an Ozempic deficiency? Do type 2 diabetics have an Ozempic deficiency? The answer is no, they don't. Those drugs are not natural to the body. So it's not a drug deficiency problem. And when you talk about restrictive, carnivore being restrictive, I mean, I'll tell you, ground beef tastes a lot different than ribeye, and you can add chicken, you can add dairy, you can add eggs. I mean, pork, bacon. Think about what you can do with all those things. That's not very restrictive when you think about that.
Well, I think Shawn hit on something that's really important, because in sick care, you're not thinking about tomorrow, you're only thinking about today, right? In wellness and prevention, you are looking towards the future. So pointing things out to people like, how do you want to live the rest of your life? I mean, what is that mindset? What does that look like to you? I think that's the discussion you need to have a little bit with people, because, since we are in healthcare, we see this, and this to me is just tragic. You see a lady that's maybe mid 60s or in her early 70s, and she falls and she shatters a bone. Game over. Life is done. People don't think about that, right? I mean, there's cardiac disease. How many people in our country die every day from a heart attack? And it came from not being able to prevent things from happening. So it was the day in and day out. And
Thank you.
we don't think about food as medicine, right? Like we don't think about food as being the building blocks to our tissue in our body. So really you kind of have to step back and say, well, we need to relearn why we are eating. We need to eat purposefully for a reason, not just to, take those calories in. We need to realize that, what we are doing every day is going to impact how we live in the next 5 and 10 years or 20.
I love that you're talking about how, if a person falls at like say 75 or 85 and they break a hip, like that could be the end of their life because they're not able to recover from
Nope.
such a traumatic fall. And I just think about this and I think to myself, I would love to live to like 120, for like a century plus. I would love to live that long. But I also want to be able to get up off of the toilet by myself.
Exactly.
I don't want to have somebody there helping me on and off a commode, where I'm in assisted living. If I can do anything to prevent that now, I want to be doing that. And that sounds kind of like it's your approach as well. Is that correct?
Yeah, for sure. And I think one of the problems is, Richelle, is that a lot of times, and especially now with the trend, when you look at a lot of 20-year-olds, whether they're male or female, I mean, you see it. I mean, they are metabolically unhealthy in their 20s. I mean, Janet and I are just astonished when we go out and we see a wedding party, and it's obvious that these people, someone just got married, there's bridesmaids and stuff, and we're talking about, one of the 10 girls is a healthy body weight. The other ones are all obese, and they're in their 20s. The problem is like Janet says, they live for the day. It's short-sighted. They're not thinking about when they're 50 or 60, because when they're 50 or 60, if they're still overweight, they're going to have all kinds of problems, be on all kinds of medications, not be very mobile. It's going to be horrible, and they don't think of the consequences 30 years later. And one of the things I say when I talk to patients or I talk to anybody about health, look, I came into this world fat, bald, and peeing my pants. I'm not going out that way. I want to be healthy until the day I die. And Janet has stories of her family members that live in their 90s and they're roping cows, and the next day they die after they got kicked by a cow because they were branding a cow. I mean, just a great story. That's how I want to go out.
Yeah, you want to go out with honor.
Right. And when you see these people, just in general, a woman that is no telling what the age is necessarily, but she looks really old and she's been over, she's got osteoporosis and walking with a walker. We have failed them in our healthcare system. We have failed them in society. There is no reason to be like that. I mean, we have patients and we follow people that are in their 70s and they are working out. They're in the gym every day. It's incredible.
One lady comes to my mind. She's 83 and she teaches 5 classes a day to younger women. And she is amazing, but you got to work at it. Like, so let's be honest. It isn't the quick answer, right? Like it's not the, pop a pill and I'm done, right? It takes work and dedication, but it doesn't take as much as what people think. So sometimes, you hear that choose your hard, right? Well, a workout sometimes is, right? But if you go at it in the mindset of, and let's say diet, we'll get back to the diet thing. If we go at a mindset that we're going to change things, as we go along, like for example, don't just, and sometimes you have to be extreme. I get it. But like for women, sometimes I'll just say, okay, let's just start with eating your protein first in your meal. And then the other things, and easier to do, right? Like I'm just changing one thing. I'm making sure I get my protein in first. And then maybe you won't have the starchy carbohydrate, right? Maybe you won't make those other choices because you're already full. So, just the mindset of making small changes can swing some big doors, right? So, start slow with, I'm going to make sure this is a priority. I'm going to make sure I get all my protein in for the day, and not not telling yourself, I can't have this. So
Right.
that restrictive thought process is being eliminated, right? It's taking away that, oh, they said I couldn't, right? And I personally do that a lot. I could eat potatoes and, fruit and vegetables all day long, right? But if I put my protein first, it's easier.
And let's just quantify that. When she means protein, she means meat.
Right.
Yes. Not just a protein shake, not nuts.
Right.
Real animal foods.
Yes.
And I think that that's kind of where people get out into the weeds a little bit too. You guys touched on a few things that I think are very important. So there was a fad that went around, and it's probably still going on, that if it fits your macros, which to me, I participated in that because I'm like, how do I fit this donut in here? How do I fit this cookie into here? I want it to fit my macros. So if my macros say that I have room for this cookie and I can still lose weight, I'm going to do what I can to eat, around that thing that I wanted. And now, obviously, my issue was that I had a restrictive binge eating disorder and a sugar and a carb addiction. So, like for me, if it fits your macros meant, how do I still get to binge while trying to maintain my weight, kind of thing. Can you speak a little bit about that, like your experience around those kind of fads?
Well, I mean, so I think at first, especially, it's good to track your macros or calories. And if you're eating real food, they go hand in hand. Your macros will just come into play if you're eating real food. And so tracking either one is probably okay. But here's the thing. But ultimately, I know when I tracked my calories religiously for like 6 years, and I stopped like a year and a half ago, finally. And one of the things is kind of like what you were saying, Richelle, is I would eat something crappy and I would, I would have an epiphany light would go on and say, wow, that's one way to screw up your calories for the day and your macros. But ultimately, then I would try to be restrictive on other things the rest of the day, which I guess was okay because it made me realize how bad I was eating. But here's the thing. If you're eating real food and good food, you don't have to worry about those things. It'll just come into play naturally. I mean, think about this, Richelle. One of the best memes I've ever seen on social media was this. There's a lion looking, it's a cartoon, and a lion is looking at a gazelle. And there's a little caption above the lion. I wonder how much protein's in that gazelle and how much fat and how many calories are in that gazelle. Did they do that? No. Did our ancestors, our grandparents, did they think, well, how many macros is in this steak that I'm about to eat and in these eggs? And what are the calories in these? No. They just ate good, real food, and then they didn't have to worry about it.
Well, I also think there is different reasons that people eat. Food actually is an acceptable form of addiction in my mind.
100%.
Because, you're not hurting anybody, right? Like, so society does not look at it as being your heroin or your addiction. So sometimes we do have to step back and say, why am I doing this? A great example is the lady Limitless Lindy, who was talking about her weight loss, right?
Mm-hmm.
And in her journey, she had to figure out, why am I doing this? So sometimes there's more to it, right? And I understand that there's sometimes it's psychological reasons we're doing something and we have to address those things. But I also think, like, for me, if I don't bring those cookies home or make those cookies or have that temptation there, then that eliminates it. So it's like planning a little bit, like when we're doing the holidays with our kids, by the way, don't have that restriction in their lives. But here's the thing. If it's gone and, a lot of times I send it out the door, then it's not a temptation, right? So sometimes it's just planning too. Like, okay, we're going to have with this meal a dessert, or even if we went out and chose to have, we would share something, right? Like, so limiting the exposure or limiting the amounts beforehand, planning it. I think can be very helpful too. So, there's different layers to this, I think. But the mindset of realizing that food is nutrition, and it really is a drug to us. It's our medicine. Like, that's how we repair and make our body tissue. So realizing that it's not just, something that we, seek out because we really love it, and realizing that it's important because it's making us who we are as a human, is a different mindset. Like that lion, his thought is, I just need to eat today because I want to eat and live for tomorrow, right? We think about it so differently as humans.
Yeah, I mean, food is meant to be nourishing to our bodies, and we're designed, ultimately we're designed to eat to live,
Right.
and eat to stay alive. Don't live to eat. But that's what we do, especially in America, and we celebrate everything with food, which is not necessarily bad, because we've done that for generations. That's not necessarily a bad thing. I mean, we used to always get together and celebrate with a meal or something, and that's okay. I mean, the problem is that we overindulge and eat the wrong foods. And I think one of the things is like Janet's talking about the food addiction, and I guess I could say I don't like using that word, food addiction, because the problem is when we say that, then a lot of people will play victims, and they'll say, well, then I need obesity is see, look at, the government says obesity is a disease. That means there's a drug to treat it. So that means it's not my problem. It's not my problem. It's I've got a disease, and somebody else needs to fix that. That's why I don't like using the words addiction or disease when it comes to obesity. But one of the problems is not only have we embraced obesity, we've glamorized obesity.
Oh, 100%.
It's horrible. And I'll tell you, and you know this, Richelle. I mean, if you go out and you talk about obesity, I mean, watch the haters come out.
Oh, and you're fat shaming. You're fat shaming.
Yep, right. And a few years ago, Sports Illustrated had, I don't remember the gal's name. She's a model, and she was on the cover of Sports Illustrated, and she probably weighed 230, 240 pounds.
Wow.
And she's a good 70, 80 pounds overweight. And I merely put it up, is this healthy or not? And I mean, the haters, I posted it, and the haters just came out and talked about fat shaming and all that. Here's what I say about it. I love obese people just like I love all people. And obesity is dangerous.
Yes.
Those are the facts. And that's why we talk about it. And obesity is not necessarily mostly caused by lack of exercise. I'm not saying that it hasn't made it worse, but the obesity problem is caused mostly from a dietary problem.
Yeah, I agree with you. And I think you guys touched on this in a few different ways. You mentioned about the meme with the lion looking at the gazelle, like contemplating, the macros and everything. I find that now is the time where more people are asking, can I have this? Can I have that? Can I get permission for this? What should my macros be? And it's like, like you said, a lion doesn't give a crap how many calories are in the darn gazelle. It just knows it's hungry and it's going to eat it. That's it. It's feast or famine. Like, if I don't kill this gazelle, I'm not eating today. And I'm not saying that we're lions and that's what we need to do. We need to run around, killing gazelles and all that kind of stuff. But I am saying, I think it's very, we're at this like pivotal shift point with people's mindset around like healthy eating and diet and obesity, and, the skinny was in and now fat's in. And it's just like, there's just, you don't know which way the pendulum's going to swing with that kind of stuff. But I think we're in this place right now where it's going to be really important for people to get back to the basics. What are the basics? What are the foundational foods that your ancestors were eating? What did they eat 200 years ago when they didn't have access to hyperpalatable, genetically modified, ultra processed foods? And I would love for you guys to talk about that as well, because that is, it's a man-made food. Like, ultra processed foods are man-made to be hyperpalatable, hyper addictive. They hit certain dopamine receptors in your brain and it makes you go crazy. And then you get this high and then you get this crash and then you have to go back to the drug of choice for another hit. Can you guys talk a little bit about that?
Well, we talk about that a lot, ancestral eating and ancestral moving and ancestral sleeping. I mean, think about what our ancestors did 100, 200, 300 plus years ago. How did they sleep? They slept at night and they moved all day long. They weren't sedentary, sitting at a desk job. They were moving all day long, whether it be collecting food, whether it be farming, whether it be chasing animals. They moved all day long. They slept at night. They didn't sleep during the day. They didn't work at night. And yes, I mean that. We are created to sleep during the night and work during the day. So, and eating the same way. What did they eat? If they couldn't grow it, if they couldn't chase it and kill it, they probably didn't eat it. There was some trade and stuff and then some exchange, I'm sure, when it came to food, but it all probably came from the ground or walked on the ground. And Richelle, I always dare people, and they always, red meat has been vilified so much.
Oh, I know.
Right. Like it causes cardiovascular disease and heart attacks. And that is the silliest thing, as Janet and I journey through this, because we used to buy that. We used to believe that, and we believed that fat was bad for us. And, we believed that, butter was bad for us. And I did.
Cholesterol.
I don't know if she ever did. Yeah.
The cholesterol conundrum.
Right. But think about what our ancestors did, and they thrived doing that.
Mm-hmm.
And so, when I'll tell somebody to say when they're sick, when they're metabolically unhealthy, whatever it is, they're trying to lose weight, they have hypertension, whatever they have, I say, well, the simplest fix is go carnivore. Go strict carnivore for 90 days, at least 30 days, and see how you feel.
Mm-hmm.
You want me to just eat red meat? Yeah. Well, isn't that dangerous? Did it kill our ancestors? I mean, they thrived on it. And this is what I tell people.
Your meat suit made out of? Your meat suit is made out of red meat too.
Exactly.
I know that's weird to say, but it's true. It's like your own muscle meat's not going to kill you. Like animal muscle meat's not going to kill you.
I mean, and think about how silly that is. I got another thing to say about that. But I tell people, I dare you. I dare you to eat too much red meat. I dare you. It's impossible. I've tried. I mean, and I've used to weigh my food and stuff when I was tracking my calories. So I would eat, and I would always try, like Janet said, I would try to eat my meat first. Mm-hmm. And we're not strict carnivores. We're omnivores. We add vegetables and fruit when necessary, and berries and stuff like that. But I tell people, it's like we do that because we can. We're not metabolically unhealthy. But if somebody's metabolically unhealthy, I'd tell them to go strict carnivore.
Yeah, exactly.
So anyway, when I would weigh my food, and almost invariably, the amount of steak I ate was 12 to 16 ounces on if I was super, super hungry. And I was just, that's it. And then this, Richelle, when you eat mostly carnivore, you don't get hungry for 16 to 20 hours. And people just, well, you guys don't eat breakfast? No, not usually. We have a cup of coffee and I'll pour some cream in it. Janet has hers black. No, not usually. I might have a little snack around 2:00, some kind of, protein meat snack maybe. And then we don't eat dinner until, around 6 or so. And that's pretty much it. And it depends on our workouts too. Mm-hmm. It depends on what our workouts are and stuff like that. And our travel, obviously you have to do that. Because sometimes, when you're flying, Richelle, you better eat in the morning because you never know when you will eat again.
Oh my gosh. I do know people who fast through all of their traveling and their flights. I'm way too nervous of a flyer to not eat before a flight. Like I have to eat a significant amount of fat just to keep myself calm.
That's us too. We travel quite a bit, and it's stressful. It really is stressful, and so we try to, and we want to make sure that we eat well. So we eat a good breakfast, that we have meat and eggs or whatever. So we're not going to those convenience stores inside the airport and eating junk.
Yes. Okay. Sorry. Go ahead.
That we share with people, if it doesn't rot, don't eat it.
Yeah. Oh, that's a good one.
If it can't rot, it doesn't come in. Yeah. Right? I mean, sometimes it's not all the truth, but for a majority of the time, that's what we practice.
Backing up on your comment about muscle, basically when you're eating red meat, you're eating muscle. I mean, you're eating almost pure protein with some fat around it. depending on the cut. But you're one of the best things I learned at a conference back in September, and it was a hormone health related conference, which it's nice to go to those because we actually see healthy people like us. There's pharmacists, doctors, nurses there, and they're healthy. They want to be healthy. They're not, you go to a typical healthcare conference and it's just a bunch of fat, overweight healthcare professionals talking about the next greatest type 2 diabetes drug. It's like, well, okay. So, and one of the speakers, she was a doctor, and she said this: if you want strong muscles and you want strong bone, you will eat muscles and you will eat bone.
Yeah.
Think about how simple that is. You're not going to eat plants to get strong muscle and bones. Those are facts. If you want strong muscles and bones, you will eat muscles and bones. So you will eat animal products. Facts.
And I just find, like, with a vegan, you just can't eat enough. My husband actually did a bodybuilding show as a vegan, and his body composition was nowhere what it was when he started eating real food. And I don't mean that to be, rude and say that vegetables aren't real food.
No. Well, just do the right. I mean, just do the math on it. A cup of iceberg lettuce has 5 calories.
Yeah.
5 calories. So, I mean, let's say we have to eat 2,000 calories a day to sustain ourselves. I mean, think about how many cups of lettuce that is. That would be, let's see, 4 times 100. 400 cups of lettuce a day.
Yeah.
That makes you real. This is the analogy I give to people. We already talked about the lion.
Right.
A lion usually hunts about 3 days a week. It eats about 2 to 3 days. A lion hunts. So when you see a lion, what do you normally see a lion doing?
If they're not hunting and eating, then they're resting.
Exactly.
And
when
they look amazing.
What is a cow? When you see a cow, what is the cow doing?
They're either chewing their cud or eating, grazing, or resting.
All day long.
Yeah.
All day long, whether it's elk, whether it's deer, whether it's gazelle, whether it's cows. Herding animals. They are vegan, they're vegetarian. They eat all day long. They have to sustain themselves.
Yeah.
So
and that's how they're built.
Right, exactly. And that's how they're designed. And they're also designed, it's amazing the way they're designed. They're designed to take grass and put and make macronutrients out of it. And it's incredible. So they take this grass and they concentrate it into protein, fat, and glycogen in their bodies. It's unbelievable, actually.
And it comes out so tasty on my plate.
Exactly. And it's meant to sustain us. I mean, it's incredible. I mean, it's really incredible. And actually, when you look at it in the physics of it, scientists don't know how it's happened. I mean, obviously, if they're scientists, they should be smart enough to know that it was just created this way. And then we have a creator that made this happen. And they know that probably, hopefully.
Yeah.
But they take the calories they get from, the grass or whatever they're eating, the hay, is actually negative calories that they take this calories and they make it into more calories in their body. It's unbelievable. It's unreal. And it's created awesomely.
So it's so interesting. Okay. I want to pause here because we have 2 questions posted and I wanted to ask if you guys are okay with that. And I also forgot to ask, do you guys have a hard stop today?
No. Go ahead.
Okay, perfect. Okay. So we have 2 questions from Marilda. So she said she's been carnivore since March 26, 2024. A lot of blessings received. Congratulations. My blood pressure is all over the place. Metoprolol has a lot of side effects. Feel much better without it. Loss of inflammation. What is your opinion?
Janet, I'll let you go.
So lowering blood pressure to me should be short term. Solving blood pressure usually comes down to, again, food and exercise and sleep. Sometimes for women, it could be also an imbalance of hormones. So, I'm not telling somebody to go off of medication because I don't want somebody to stroke out either. However, I do think there are things that we can do along the way. And we've seen this many times with some of our providers that we work with. When you work with your diet, your sleep, and your hormone balance, that those things can be eliminated. So really it depends on the situation, but I agree with you. The side effects of metoprolol can be extreme and it can be really frustrating. So, hopefully you have a provider that will help you taper down on the dose and taper you off of that in therapy of, correct diet, weight loss, sleep, and activity.
And let me just hit on some of those details. So, is that it's Marlita? So, Marlita, we don't have enough information with just this quick question. I love your question. Thank you for asking. If you want to reach out to either Shawn Needham or Janet Needham on social media, find us on social media, reach out to us and we can get more details of this. But here's the thing, you say it's all over the place. So what does that mean it's all over the place? First of all, we don't know the number. So is your blood pressure 130 over 80? Is it 170 over 110? Is it only high when you go to the doctor and check it? What is it in the morning when you check it? What is it? Do you take metoprolol twice a day, once a day? Does it matter when you take your metoprolol? Because we want to see what your blood pressure is averaging over the long term. So first and foremost, realize this, that you have to be consistent at measuring your blood pressure and know what it is consistently, not just one time at the doctor's office or not just one time during the day after you exercised or whatever. And also some people's blood pressure, depending on age, as we age, our blood pressure should maybe go up a little bit more. And some people just run a little bit high anyway. Realize this, that some of the blood pressure numbers, when Jan and I were in school, it was 140 over 90, and anything over that was hypertension, you're going to stroke out. So you better put you on a drug. Well, they've lowered that to 130 over 80. And the reason they do that is I'm just being really honest with you. They do this with blood sugar. They do it with a lot of other numbers too. They did it with cholesterol. They do that because they keep lowering the standards so more people have to go on drugs. Now, I'm not saying high blood pressure is good, because it's not. It is bad, and it's probably one of the most dangerous things, cardiovascular speaking. But you can change it with diet for sure. So we need to know more of the details about what your blood pressure is actually running and what it is doing on an average to really answer those questions. But metoprolol, side effects of metoprolol is exercise intolerance, because it lowers your heart rate, so you can't exercise as well because you can't get your heart rate up. That's a problem. It causes depression and it causes sexual dysfunction. So those are, I would not want to be on that drug. So anyway, if you could reach out to us, we can get you more details on that.
Okay, great. She has a follow-up question here. Blood pressure cuffs used don't function well, take 3 readings and all over the place. Which one do you recommend? Take readings correctly. Do you have a recommendation on a cuff?
Not necessarily. I wouldn't say there's necessarily any better or a good ones out there. I'd like to know. I'd like to ask more questions as far as details. First of all, it's good that you're not trusting all those numbers. Check your blood pressure on one arm versus the other arm. See if that works any differently. The wrist ones aren't as good as the ones up on the top of your arm. One of the things is if you do have bigger arms, like I have bigger arms, blood pressure cuffs don't work well for me. The standard size, they just won't work. They won't get good readings. So those are some things that you have to question.
Okay, great. And we have another question here. I'll pull it up from Pavarthi. I was 105 kilograms in October and I came across carnivore diet. I am now down to 89 kilograms. Congratulations. Woo! It feels amazing, but I keep slipping to cravings for carbs at times. How do I really control the cravings? I have some thoughts about this, but I want to hear from you guys.
Yeah, so I would say to control the cravings, eat meat. I crave carbs, and I don't know if that'll ever go away. And here's one of the things too. So let's realize why you crave carbs. So, like for instance, Jan and I I'm a mountain bike racer, and we train as cyclists. So sometimes we'll do 4 or 5 hour bike rides. Afterwards, I crave carbs. Mm-hmm. I like bananas. I like fruit. So Is that a bad thing? No. Now, the keto people will tell you that's a bad thing. I call BS. It's not. You got to listen to your body. And my body craves carbs when we have long workouts or really, 2 hour, not, 2 hour really extreme workouts when I race. I crave carbs and I eat carbs. And I mean, there's times I'll drink pure sugar and that's okay in my opinion. But I do that around certain workouts. So why is your body craving carbs? Is it because you're working out intensely? Maybe you need carbs, possibly. If not, then I would say eat meat. Janet, what do you got to say?
So the one thing we really haven't touched on a lot today is hydration. And that's one thing that I usually tell women that we forget to do is to hydrate properly. So hydration can be very helpful in the times that you're craving something. I just go back to when I was pregnant with my sons. Was I hungry or was I thirsty? So I think trying to hydrate first is probably the first thing that I would throw out. And then, sometimes cravings happen at a certain time. Certain people are susceptible to certain cravings at different times of the day or where they are. It could be just that, like Shawn said, your body's saying, hey, I need something here. So if if you hit a certain time during the day at 3:00 or wherever that time is, be prepared with some protein to help you get through that time frame. Set yourself up for success. And I'm not saying that falling to a craving is the end of the world, but if you do have an eating disorder, try to do your very best to avoid it. I talk about this a lot because for most of the foods out there, I don't really have like this strong desire to eat it, except for cookies. I love cookies. So I don't have them in my house that I don't know. I know where I can go with it. So, I plan around that, but I think hydration can be something that's overlooked a lot. And I don't mean just pure water. A lot of times I will use just some electrolyte water. And that does a lot because that's sometimes enough to be satisfied to get through a certain time frame during the day. And I just don't think as a culture that we are hydrating ourselves properly. So, I'll do like water with some electrolytes in it, and that can make a big difference for me throughout the day.
And I think a lot of times on the hydration issue, you are craving, electrolytes can help with carbohydrate cravings. That might not always be the issue, but if you think about what carbohydrate means, hydrate, carbohydrates, they pull in water.
Right.
So it could be that you are dehydrated.
Yes, I agree with what you guys just shared. I would also touch on, I'm sorry if I'm saying your name wrong, but Parvati, you just started in October and you've had this really dramatic weight loss in a couple of months, which is amazing. I think part of what you might need to look into is because carnivore is so nutrient dense, it is so satiating. Sometimes what can happen is we start under eating. And when we start under eating, things like cravings can start showing up because our body's like, hey, I know how to get nourishment. I'll start pinging you with these messages like, here's a craving, here's a craving, here's a craving, here's a craving. And it's not that your body is actually craving that carb per se, but it's actually craving nourishment. So I would ask you, and I would invite you to maybe track for a little while and just take notes for yourself. Like, how much am I actually eating? Am I under eating protein? Am I under eating fat? Is that why maybe my hormones are kind of getting a little bit discombobulated at this point because now I'm not eating enough to actually nourish my body. I think, like I said, carnivore is amazing. And you've already seen such a significant weight loss and, so many benefits, but it's like, you also have to be mindful that it is very, very, very easy to undereat on carnivore. So that would be kind of my thoughts on this as well. I love the hydration aspect as well. I think that that's really important. And yeah, talking about being, pregnant and breastfeeding and are you thirsty or are you hungry? sometimes it's both. Yeah. Great question. That is our last question that we have so far. Okay. So I wanted to ask you both, a question. Could you guys talk about what are some signs of metabolic health?
Sorry, I got to plug my computer.
Yeah, no problem.
So, I mean, we talk a lot about in healthcare numbers, but let's be honest. First of all, observation, right? Your skin health, your appearance, those things are important. It's kind of crazy that Shawn and I we talk about this, but we can look at somebody over time and say, ooh, this person's skin tone doesn't look healthy. They're inflamed. You can tell. So appearance can be, but also metabolically, if we're looking at labs, if somebody's insulin levels are not good, that usually is saying that they're not addressing in their body their glucose that is being put in them. So they're not able to respond to that. So that can be one thing. There can be, moodiness, emotional issues, that plays in it. Many times we'll have women that are going through hormonal changes, and the hormonal aspect with the calories that they are consuming, that if they're all carbs, can really throw them into a different place. So it can be emotionally and mental things that you pick up on, especially when people cycle. That can be something.
Well, I like the mirror test. I don't think there's anything better than to look physically at somebody. And I know that sounds so shallow to some people. And going back on that fat shaming thing, when you see somebody that's obese and you say that they're metabolically unhealthy, some people will argue it's like, well, you haven't even seen their labs. You have no idea, what kind of diseases they have. No, you're right. I don't, but I can see that they're not metabolically healthy. They're not. They're obese. Let's just admit it. So the mirror test is the most important. We have all these fancy lab tests. We have all these fancy diagnostic criteria, all this fancy imaging. I'm not saying those things aren't bad necessarily, but let's face it. You can look at somebody and tell if they're metabolically healthy. Veterinarians do it all the time. I remember seeing a veterinarian one time, and they looked at a cow and they said, "Oh, that cow's sick." I'm like, "Oh, how can you tell it's sick?" Well, they could just tell the cow was sick by looking at it. And you get good at that when you start evaluating people and you start evaluating their health. I mean, Janet and I can look at somebody and see if they're hormonal deficient in certain hormones because we've done that with thousands of people. So I think the mirror test is very important. One of the labs that she talked about, I think your insulin level is more important than your glucose level, actually. Being an endurance athlete, sometimes my glucose will run high, but my insulin's really low because my body says, oh, you need glucose because you're burning it. But my insulin's low because I don't need insulin to take it away because my exercise takes it away. But another important lab, when you talk about lipids, cholesterol is garbage. Don't trust your total cholesterol. It means nothing. Your total LDL or your LDL, especially if you're carnivore, don't worry about it. Don't listen to your doctor. Cholesterol is not going to kill you. Egg yolk is 80% cholesterol, and you're going to tell me that cholesterol is bad and it's going to sustain a baby chicken? I'm not buying it. That's one of the first drugs that Janet and I realized statins are horrible. I would never recommend them. But in the cholesterol panel, the lipid panel, there's a triglyceride and an HDL ratio. I think that one's important, and not because of the number, but because we can look at that and you can see if somebody's metabolically healthy. You can just tell what they're eating by, if they have a high triglyceride to a low HDL, you can tell they're probably sedentary and they're probably not eating well.
Mm-hmm. Yeah, I would say,
or they're inflamed.
Right. My triglycerides were cut in half in the last year and a bit from carnivore. Like I've been carnivore for 2 yees, but I did lab work a year into it, and then just again a year after, and I was like, whoa! Like I didn't think that was the thing, but yeah, like my triglycerides were cut in half. I was like, okay, this is good news.
Even though you're eating saturated fat.
saturated animal fat, and sometimes
Right.
butter by the block, not
Right.
stick, by the block. I just crave it. I'm like, I don't know what to tell you, man. It tastes really good to me. So I wanted to ask you as well, Janet and Shawn, why do you guys call it sick care instead of health care?
Well, when you look at our healthcare system, does our system try to keep people healthy? No, they treat sick people. They love treating sick people. Do you really think our system wants to reverse type 2 diabetes? Are you kidding me? Look at the people that would be out of a job. The diabetic educators wouldn't have a job anymore. Most endocrinologists wouldn't have a job anymore. You know, where the system is designed to keep people sick. Most drugs, like we already talked about, they're made for people that have a condition. So if you reverse that condition, the money goes away. So there's no incentive to keep people healthy.
So the difference between when I grew up to where we are now, just to give you a scenario. When I was a teenager, I had a local physician who actually took the time when you went in to help you. So, for example, I had a sprained ankle, and I went in, and he, made sure I hadn't broke it, but he gave me the, therapy of how you were going to rehab it. Of course, my coach did too, my basketball coach did too, but the doctor is teaching you how to rehab and teaching you how to repair your body, right? Another scenario this doctor did was I had some lung issues. I think I developed pneumonia one year, and it was before, I was going to go into training for basketball. And, so he sat down and talked to me about what I could do to increase my lung capacity. That is not the therapy that we get from our doctors now. They're not talking about activity, food, sleep. What they're telling you in 5 or 10 minutes is what new drug to take. So when we talk about sick care, what we're really saying is the insurance company is the consumer, the patient is not. So you keep giving them one more drug, and as you add one more thing, there's one more side effect. So again, that person does not heal. They just become more sick. They're just in a cycle of one more time you come in, we're going to check and see how you're doing. Oh, this is not going right for you. You feel like this. So we're going to give you one more thing to make you feel better. And that list starts growing. And literally, when we were practicing in that model, people were leaving with bags of prescriptions.
Right. I mean, when you think about when Janet goes back to her history, what would happen today if you walked into an office with a sprained ankle? Which I would never go to the doctor for a sprained ankle anymore, because all they would do would prescribe an anti-inflammatory. Well, let's give you some anti-inflammatories. Oh, okay, right. And then for her lung problem, they'd give her an inhaler. I guarantee they'd give her an inhaler. That's not what she needed. But most doctors now just prescribe drugs, and it's by design. So insurance companies have colluded with drug companies to create a cartel to rip off consumers. And basically how they've done that is they've made it to where the reimbursement model for a physician is so low that they've got to see so many patients an hour, or a day or whatever. So what do you have time to do with the average? I think the average physician spends 7 minutes with a patient. In 7 minutes, you can't talk about diet. You can't talk about sleep. You can't talk about exercise. You can prescribe a drug. It's all by design. The drug companies have colluded with the insurance companies to make this happen. And guess what? The drug companies then tell the insurance company, we want this drug on our formulary, and we will give you this much more money if you make sure that this percentage of people have this drug. I'm not kidding. You can't make this up. This is like mafia type tactics, and it's legal.
Yeah. And that's the scary part. I don't know if you guys heard RFK Jr. talking about this recently, but he was talking about like pediatricians and I don't even want to say the word because my video will get banned, but he was talking about how the most pediatricians, and I'm very blessed and fortunate to have a really amazing pediatrician, but most of them are trying to have the majority of their patients receive these injections because they want to get their bonus of like $300,000-$400,000.
Right.
If they can reach a certain quota, what is it, 80 or 85%? If they can reach that target number, then they get this huge bonus. And I'm just like, they don't give a crap about your kids. They don't give a crap about your health. They just give a crap about their payroll at the end of the day, their paycheck, their bank account. And I'm like, they're so sick.
Right. And let's just go a step further with that. It's not necessarily, because if you talk to an individual doctor, most doctors are employed by hospitals or big healthcare groups now. So they don't understand this thing. And they'll even argue, they'll say, well, my reimbursement, my paycheck doesn't matter on what drug I prescribe or whatever. They don't understand that anymore because they don't see those numbers above. But it literally does affect how much their company gets paid. Would it affect their paycheck? It just depends, because most of them are employed. But this is nothing new, Richelle. We've been doing this with drugs for a long time. Mm-hmm. And a good example is statins, the anti-cholesterol drugs. So if you check a patient's cholesterol and their cholesterol is 201, then standard of care is that you have to put them on a statin. Doesn't matter what their triglyceride is, doesn't matter what their weight is, doesn't matter what their blood pressure is, doesn't matter any of their cardiovascular risk. Their cholesterol is 201, they need to go on a statin. This is all by design with the electronic medical records. This is all in the records, and the insurance company can go through and they can say, hey, Dr. Joe Blow, you've got 5 patients here that have a cholesterol of over 200 and you have not prescribed statins for it. We're going to decrease your reimbursement by 1% if you don't make sure they go on statins. That will also actually flag a pharmacist to call the doctor and recommend a statin. So when pharmacists do that and recommend a blood pressure drug or recommend a statin, it's not out of the goodness of their hearts because they're getting reimbursed from an insurance company too. And the doctor gets a better reimbursement also. So it's all by design. It's incredible what has happened. And that's one of the reasons that Janet and I really want to educate and empower people to take charge of their own health, because our healthcare system does not care about their health.
Yeah. Yep. I'm with you. And that actually is the perfect segue for this question from our viewer, Charmaine. Hey, Charmaine, is there a safe way to stop taking statins? Do you need a doctor's supervision or can you just stop cold turkey?
Okay, so first of all, I'm going to say we're pharmacists. We're not doctors. This is not medical advice. But if I or one of my close family members was on a statin, I would stop it immediately. It causes muscle pain. It causes liver side effects. It can cause fatigue. It can cause decreased testosterone levels because cholesterol is a backbone of making hormones. I would stop it immediately. And it's not one of those drugs like some blood pressure medications where you get rebound, or some antidepressants where you get, you have withdrawal symptoms. Statins aren't like that.
There are some nutrients that statins deplete, and we've known this for a long time. So any of my clients that do take statins or they go off of statins, I want them to take CoQ10 because that is really important for the body to repair. And I strongly would want somebody to do carnivore or keto at least, because the statins, in my opinion, is one of the reasons we have such high dementia and Alzheimer's in our country, because our central nervous system and our brain depends on cholesterol to be healthy. And so we've deprived it nutrients. And so that to me is something super important that I would consider. And obviously, since Shawn and I are in the profession of hormones, I would make sure that you had a really decent testosterone level as well as your thyroid level, because those things can impact your cardiovascular health as well.
Great answers. Okay, she has another question. Now, I know we talked about this a little bit earlier, so definitely, Charmaine, definitely check out the earlier part of this episode. Can you talk about your opinion on people in the carnivore space adding GLP-1s to reach their weight loss goals? They are presenting them as an amino acid, not a drug. What are your thoughts?
Well, let's realize that they are a peptide, which is an amino acid chain. So that is true. But the definition of a drug is anything that goes into our body and makes physical, chemical changes in our body. So it's definitely a drug. That a drug is a very broad term. So here's the thing: if without knowing more details of what your weight is and what your weight loss goals are and how carnivore has been helping that, if you're seriously on strict carnivore and you're okay with that, I would not recommend going on GLP-1 receptor agonists. I would just stick with carnivore, and remember, the scale is not black. The scale is black and white, but it's not about the scale. It's about body composition. Mm-hmm. And I will tell you this: I am 40 pounds over my ideal body weight by BMI. So it's not just about your height and your weight. It's about what kind of muscle mass do you have? What kind of lean body mass do you have? That's what's important. It's your body composition. So don't stress too much about the scale. It can be a tool. And yes, I do weigh myself, but I've also had a DEXA scan to show how much muscle mass I have versus fat. And that's the most important part. So let's not get too restricted on just the scale. And going carnivore, like we talked about, how it's important for muscles and bones. Going carnivore, you can actually sometimes increase your weight by increasing your lean body mass. That's not a bad thing. Remember, the mirror test. What do you look like in the mirror? That's what's important.
So we talked about how much fat loss and then how much muscle loss is in using these products. And so, yes, along with protein and exercise, I think it's safer. However, the actual way that these drugs work is they stop the motility of the gut. To me, that can lead to some really long-term issues. We make our neurotransmitters in our stomach. So that's going to affect our brain, right? My heart is a muscle. I don't want to lose any muscle mass in my heart. So there's a lot of red flags and a lot of things going off in my brain when we talk about this. So in my opinion, and this is just my opinion, if you do choose to do this route, choose only for a short period of time and realize that your health is a long-term journey. It's not immediate. Right. I think what we're looking for in our culture is a fast fix. What happened to our bodies and what happened to us didn't occur overnight. It was a gradual thing that we did in our lifestyle or to ourselves. So giving ourselves the time to recover in a healthier way over time, I think long-term is a better outcome. And I really want the weight for people to be lost in the visceral area, because that's the dangerous thing, right? So anything that you can do to keep your lean muscle mass and your muscles, to me, long-term is the goal.
And believe me, when you're 80 years old, God willing, you'll be glad you had muscle mass. Trust me.
Yeah. And she said, thank you. She's not tempted by GLP-1s. And she also shared that she was prescribed Ozempic a few years ago before she was aware of the dangers. And she was keto then. And she's been carnivore for almost a year now.
Good for you.
So that's amazing. That is amazing. Awesome. Okay. I don't want to keep you guys too much longer. So I would love for you guys to shamelessly plug about any projects that you're working on. And where can people find you and how can they connect with you guys?
So we have a podcast of our own, and you've been on our podcast. Thank you so much, Richelle. It's called Health Solutions with Shawn and Janet Needham. I think it's, where is it? Right here. We're at all the podcast forums, including the YouTube channel. And our pharmacy is, if you go to, probably the easy way to find us is go to mlrx.com, which is, where is this? right here. Our pharmacy name, go to mlrx.com and you can have a link to our podcast. There's a link to our podcast. There's a way to get a hold of us on there, of course. And our goal is to educate and empower individuals to take charge of their own health. And we want people to realize, we're two pharmacists that don't believe in drugs for long-term disease. Now, we do believe in hormone replacement, because I think that's as we age, our hormone levels go down, and that's very, very important. And we just launched a women's health series. And we're basically journeying a 10-part series for women's health from the time of menses to the time of postmenopause and beyond. And hormones can be life-changing when it comes to, depression, when it comes to sexual function, when it comes to, bone density, fertility, PMS, headaches, all kinds of things can be prevented by having hormone balance, blood pressure issues, cholesterol issues, lipid issues, all those. So that's what we want to educate people about, is that, having two pharmacists that don't believe in drug therapy is very, very powerful. And we honestly believe, Richelle, that it is our purpose and our passion to share this knowledge. I actually wrote a book about it too. The book is called Sickened: How the Government Ruined Healthcare and How to Fix It. And it talks about this, and it's amazing how I don't believe in coincidences, and the timing of my book was just impeccable. It came out December 24th, so Christmas Eve, 2019. So right before the COVID pandemic. And, I know we're on YouTube, so I won't go into that too much. I don't want to get censored, but it was a perfect time for that book to be launched because during COVID, I think people realized that, the system might not have their best interests in mind. And really the best way to stay out of the hospital, to stay out of the doctor's office, it's right here. Mm-hmm. It's us. The best health insurance we have is not some kind of policy that we can buy. It's how we take care of our bodies. And that's in chapter 6 of my book. There's a 6-step solution on how to fix healthcare in that book. And one of them is to empower yourself to take charge of your own health.
Amazing. And you guys, I will be linking all of Shawn and Janet's contact information down below, including the website mlrx.com, as well as the link to their podcast. You guys, it has been an absolute pleasure having you here today. And I just want to thank you from my whole heart for all of the thoughts and opinions that you were willing to share on this episode. And I'm just so grateful for you guys. Thank you for doing what you're doing and being such a strong voice in this movement right now, because it's so needed. I just appreciate you guys so much.
Thank you for having us on. It was a privilege.
Thank you. And if you guys haven't done so already, please don't hesitate to go and like and subscribe to this video. Drop us a comment. Let us know where you're tuning in from. Go on over and subscribe to their podcast, the Health Solutions Podcast with Shawn and Janet Needham. And you guys, this is Richelle, the Real Life Carnivore, signing out. Bye for now.